One of the reasons I like surgery probably the most is it just kind of takes all the specialties. It's not just doing surgery, not just making incisions and taking things out. There's a lot of medicine involved. Sometimes we do a lot of surgeries on emergency, so there's kind of knowing all the different specialties. Oncology, we do a lot of cancer surgery, and then of course like orthopedic stuff, a lot like carpentry. Some of the wounds we close, it takes a lot of creativity. So just kind of while it is just one specialty, it involves kind of all the specialties and it kind of just takes all of you. And I find that very interesting. Here at NVS, we have 3 operating rooms. We have a sterile hallway that separates the hospital from those operating rooms. We are all have cap and mask, glove, fully gowned. The patients are fully draped in. In general, you would not be able to tell it's a dog or a cat having surgery. It could be a person with the level of sterility and the monitoring, very much like a human having surgery and anesthesia.
Well, there are so many general procedures out there, but there are a lot of more specialized procedures, and it's not even just about doing the procedures, it's also about knowing when to do the procedures, what the best timing is, what those procedures are specifically or variations of those procedures, how the recovery period should go, and how to deal with the complications. I think there are a lot of those details that we just get through the specialty training and the specialty experience over the years that I think really do help serve the client. And also NVS in particular with our post-operative management, we have the 24-hour care afterwards, which I think is a very important part of the recovery process. Just post-anesthesia, the recoveries can be difficult for owners sometimes to see.
So somebody who's a surgeon, they spend the vast majority of their professional career really focused on one thing. And so, there's a skill set that develops out of that. And so the advantages are that, there's a lot of surgical indications, and there are, surgical indications that are on a different spectrum as far as more complicated or more simple.